Hello, ladies and gentlemen. My name is Dr. Kalitenko, and today we are going to talk about Crohn's disease and ulcerative colitis. As probably you know that ulcerative colitis and Crohn's disease, even though they are quite different in clinical presentation, and they sometimes consider as a kind of similar diseases because most likely the reason why a patient has those diseases is quite similar. And in my understanding, the most important finding about Crohn's disease and ulcerative colitis was the astonishing fact that they found out that if drugs really don't work, so the patient might benefit from a transplantation of gut bacteria from a healthy person to a sick person. And I think the first they did it in Australia, and it showed quite promising results, and people are even going to Australia with intractable ulcerative colitis in terms of get some help. So why, in my understanding, this is a very important thing, because it's just a very simple, it shows quite a simple thing, that our immunity as well as health, general health, and especially when somebody has a problem with digestive system is dependent on what bacteria we have in our digestive tract. And it quite makes sense because about 70 to 80% of immune system is located in digestive tract. So if somebody has a problem like Crohn bacteria or bacterial overgrowth parasites who eats wrong foods, it creates a huge problem. And that's why for my patients who have ulcerative colitis or Crohn's disease, we usually try to figure out what good bacteria they are missing or what bad bacteria they have, so we can create a treatment plan, because if we really don't know where the problem is, we can't really help. And in terms of supplements that might give you support you need to fight those diseases, it's obviously the group of supplements that can support your immune system. And obviously it's omega-3 fatty acids, vitamin C, vitamin D. Also you need something to promote healing. And everybody knows that in order to heal you need three things. You need zinc, you need ascorbic acid, which is vitamin C, and you need proteins, amino acids. So that's what you need. That's why for our patients who have ulcerative colitis or Crohn's disease, we usually give a recommend support of vitamin C, zinc. Obviously, we recommend diet that have enough proteins in it. Obviously, we need also magnesium, because magnesium has about 300 functions in our body. 2 or 300 functions. Some people say 200, some people say 300. It really doesn't matter, because because magnesium is extremely important for almost every aspect of our health. And also we recommend B complex. Why B complex? Because B complex is necessary for energy production, for creating and building blocks of our body, which is methyl group. It's extremely important, especially B12, and for our brain function, for everything. And obviously the probiotics are extremely important, but good probiotics, make sure that you have medical grade, and you have the probiotics you need. Obviously, if this may not be enough, then you need to go to a doctor who is specializing in finding the root cause of your problem and get your digestive system examined in terms of good bacteria, bad bacteria, because unless we know where the problem is, we clearly can treat. Some people might have parasites, so that's one treatment. Another group of people can have yeast infections, those are totally different. The third group can have bacterial overgrowth, so we need culture to know exactly what we are dealing here with and how to treat the most important thing. But the support of those supplements, as I said, like magnesium, zinc, vitamin C, vitamin D, omega-3 fatty acids, can give you support you need to fight those diseases. Thank you.